Forensicare plays a really important role in forensic mental health services in Victoria by providing services across prisons, hospital and in the community. So it's really a continuity of care from entry into the service through the prison system.
We are the organisation which holds the sole focus of working with people with that intersection of mental health and criminal justice, and it's our focus to make sure that we're all working towards the same goal of helping people with lots of these areas of community stigma.
Forensicare is really a unique organisation in that we're a specialist mental health service, but we don't just provide mental health services. We work in the courts, we work in the prisons, we work at Thomas Embling Hospital and in the community.
We provide a continuity of care from the prison through to the hospital and back again, or from the prison to hospital and then out into communities.
Forensicare plays a really important role across both the broader mental health service as well as our criminal justice system. The tentacles across two quite different systems to be able to provide the care and support to people who are connected in both of them.
Forensicare, in the work that it does in the prisons, is identifying people who are at high risk, identifying people who have fallen through the cracks.
In the last 10 years, we've seen, unfortunately, an explosion really in prisoner numbers, almost a tripling in that time. And as a result, the needs of people in corrections with mental illness has just grown. That's where we really need to move.
The work we do that helps stop people with a mental illness coming into contact with the law. If they do, how do we make sure that they still get the right treatment at the right time? And when that treatment is over, that they actually are able to integrate and connect into whatever other systems of care are possible.
My role is a lived experience role, and the lived experience workforce in mental health is a new emerging workforce. And I think in 20 years' time, there'll be a huge workforce of lived experience staff providing support to both patients and their families.
A holistic approach to mental health recovery is important because we need to help every aspect of our health. They are all connected, so by strengthening someone's physical health, they're able to get out and do more activities and participate more, which will only help their mental health.
Looking at things like family linkages, connection to the community, employment opportunities, accommodation, linking into area mental health services. Very few people would remember G Division in Pentridge, but it was the mental health unit. From the prisoner's point of view, so many just went through an entire sentence without having any connection to the organisation. The transition from back in those days to now has just leaps and bounds. Now we've got a dedicated team that forensically look at every aspect of a patient when they come into the organisation and then transitioning to a place of reintegration.
I, not that long ago, went to something called Coffee Chat, which is held on our Tambo unit in prison. And I do remember the words of one of the young men who was about to graduate, leave, and in fact leave prison. And what coming to one of our custodial units meant, where for the first time he could begin to make sense of his mental health issues, he could find treatment that helped, but more importantly, begin to understand what recovery meant so he didn't end up in the same circumstances again.
We initiated Coffee Chat the middle of last year. We established that with the view of bringing community people in from the outside, members of parliament to community service organisations, come in and meet with the guys, talk about the services that they provide and how they could benefit once they're out, linking in with those services.
Forensicare has a role of leadership in the development and advancement of forensic mental health services for the state of Victoria and also Australia.
The work that we are doing, I think, is really important. There needs to be significant expansion of the resources available, particularly at that hospital-prison interface and that prison-community interface. And we continue to work with government around that.
Over the next 5-10 years, we'll hopefully be expanding more to be dedicating more time and resources to looking at what we can be doing from a research perspective and an evaluation perspective and leading the way.
Forensicare, having expertise in forensic mental health, has a very significant role to play, working with police, working with the courts, obviously continuing to work close with corrections, with our own forensic psychiatric hospital and our own community services. And all of this needs to be buttressed and supported by a rigorous evaluation and research program to ensure that what we're doing is best practice and meeting the needs of our consumer group and the broader community.
We're really fortunate that we have a strong link with Swinburne University. That association with Swinburne allows us to be doing some groundbreaking research into forensic mental health. Forensicare, I think, can be the service that everyone else looks to for guidance and for support.
Think back 20 years ago, you'd say you worked at Forensicare or Victorian Institute of Forensic Mental Health, and people really didn't know what you were talking about. Now we're much more integrated into the overall mental health system.
I feel I've been very fortunate to be able to spend the majority of my career in a service like Forensicare.